Hello, Namaste, Sat Shri Akal. I am Samiksha, Director EMC Hospitals, and with me is Dr. Moni, Neuropsychiatrist at EMC Cradle and EMC Hospitals. This is a short video addressed to the women of Phulkari regarding the recent blackout situation in Amritsar. Dr. Moni, thank you for taking out the time to make this very important conversation for Phulkari women of Amritsar. As you already know, Mrs. Meenakshi Khanna, who is the president of Phulkari Women of Amritsar, has highlighted this very important scenario right now in Amritsar, which is the rise in cases of stress, anxiety and panic attacks among members of our community and of people of Amritsar at large. So, did you anticipate this kind of psychological reactions to this situation?
Yeah. Yes, absolutely, because these are normal responses to such abnormal events. People might feel anxious, fearless, sometimes they may feel more irritable, hopeless and helpless. It is important to acknowledge these responses because people might not know what is happening within them. So they have to understand their feelings, acknowledge it so that they can take better care of their mental health. And absolutely 100% these are completely normal responses to such abnormal situations.
That's very comforting to know. But can you also give some practical advice to people to deal with this kind of stress?
Yeah. So honestly speaking, we cannot say that you have to stay calm. That doesn't make sense, isn't it? So everyone will feel stressed when it comes to such situations, but there are few things that can effectively ease our stress or anxiety. The first one would be, I will say, limit your exposure to media, especially the television news and the social media coverage, because constantly exposed to such things can escalate the anxiety and it is not going to help at all. It is important for the people to stay informed about what's happening, but it is also essential to take breaks from such coverage. So that will be my first advice.
Misinformation, as they say,
Yes,
does a lot of
so
harm.
rumors, false news, so they are going to escalate everything. The second one is try to follow your daily routine. Try to wake up at the same time, eat your meals at the same time like you usually do, follow a sleep routine, talk to people, do not stay isolated, and talk to people, talk to your family and friends, share your feelings, share how you are feeling. So sticking up to the daily routine is will make you to feel that you are in control.
When someone talks to you, what should be their general reaction to this to make sure that the other person feels comforted rather than feel more anxious about it?
So I think when someone is going to share their feelings with you, it is important that you are not going to judge their feelings. You have to be open and a good listener probably to whatever they are saying, so that it itself is a therapy, isn't it? When someone is honestly listening to whatever you are saying.
I think that's what makes you a great therapist, is your listening skills, patient listening
Yeah,
skills.
I believe in that so much. So I think it is important to be empathetic, actively listening, and not to be judgmental when someone is sharing these feelings with you.
Now that we're talking of being judgmental, you've been at EMC back in 2018, and then of course you went to the UK, you practiced there for many years, and now that you're back to Amritsar and to Punjab, do you see a difference in the approach of people towards mental health problems, and do you think that it has destigmatized to some extent when people want to seek help for it?
Yeah, I'm seeing a significant difference compared to my previous practice. People were quite hesitant to meet a psychiatrist due to the stigma, but right now people themselves are asking to see a psychiatrist, both outpatient and inpatient, and it's quite shockingly happy, I should say, probably because of the technology, because of the social media. The awareness has tremendously increased now, so people are eagerly waiting to see the psychiatrist these days, because they understood that it is not about getting treatment like medications for significant mental illness, but rather than getting support regarding the stress management and to improve the quality of life. So I'm seeing a huge difference now.
Even ever since we've launched EMC Cradle, I think we're seeing a very good response of the community towards approaching us openly and seeking appointments with you. And it's probably because, as you always say, that people who face these problems are not patients. You know, anyone could go through this, and I think that's what having a good environment, a good hospital, a welcoming space where you do not feel judged, where you feel safe to go up to and talk about these things helps sometimes.
So yes, so in mental health we use a term inclusiveness. So it is important that people should feel inclusive and they should have that open space to share their feelings and emotions, and that's where the role of mental health professionals comes, and I think we are doing that now.
Thank you, Dr. Moni, for this very, very important and timely conversation. And for anyone feeling such emotions at this point, would it be normal for them to come and see you or any other psychiatrist if they feel so?
Yes, of course. So during such difficult situations, I understand that especially this is for people who are already suffering with mental health. I would like to say to you all that it is important that you have to continue with the medications and try and book an appointment with your psychiatrist as soon as possible to have a review of your mental health. And if you feel more panicky, if you are not sleeping for many nights, please consult a mental health professional. You don't have to suffer within yourselves.
That's the biggest message, that you're not alone in this and you don't have to suffer. If it makes you feel better, talk to people around you. If that still doesn't help, maybe go and seek help. There is nothing to be scared. There is nothing to feel ashamed about. It's just normal, and we're all in this together.
Yes, of course. You're not alone. We are all in this together.
Thank you.
Thank you.